everyone, and welcome back to the Healing Your DID course. I want to thank you for becoming a member to get access to this course. In today's topic, we're going to be talking about signs and symptoms of DID. So the general symptoms include depression, anxiety, post-traumatic stress disorder, PTSD, and other dissociative disorders. And the problem with this is that these are very general symptoms. A lot of people will have these symptoms based on a lot of different things that happen within their life. So these are the general symptoms that a lot of people can experience for all sorts of reasons. And the thing is, DID can go undetected, and it can go undetected for a very long time, many years even. People may not know that there is anything wrong. And this is often because there is some sort of barrier within their mind that is preventing them from knowing that anything is wrong. Perhaps they are a different personality when something goes wrong. So if they start to feel bad, if they start to get triggered by some sort of negative experience, a alter personality could come out and take control, and it's like, well, there's nothing wrong. And they may not seek help since they have no symptoms. They may feel as though everything is perfectly fine. There may be some minor symptoms, and they may not know why. But the last thing on their mind is going to be some sort of multiple personality diagnosis. One of the main things is trauma barriers. These are basically walls that are put up to block trauma from entering into the conscious mind. The trauma is subconscious at this point, or even in the deeper parts of the unconscious mind. And when that happens, the person will be completely unaware that there is any sort of trauma that happened to them. There could be certain alters that have memories that others do not. So maybe there was a specific alter personality that took on the trauma as a child. This trauma that they have taken on is all within them. Within the other personalities, they don't know about it. They don't even acknowledge it to be true. Even if there is any sort of glimpse of it, they will deny it because it's like, well, that didn't happen to me. I don't have any memory of that. That can't be true. It's not true. And this creates a major wall and prevents people from healing. Therapy cannot help unless the alter personality who experienced the abuse is present. So if the person goes to the therapist because others around them maybe suggest that they need some sort of therapy, or maybe they have other minor issues, the therapist may not even know what they're truly dealing with deep down because the personality that's going to see the therapist is not one that experiences the majority of the problems. It could be one that goes out into public and is usually fine without any sort of major issues. So that causes a major problem for healing. Amnesia is also another major symptom when it comes to DID. And this is, people will lose time, whether that be in the present day. Maybe they lose some amount of time dissociating, being someone else. I think we've all had that feeling of when we're kind of zoning out, and maybe we're daydreaming how much time ends up going by and we kind of forget. Or maybe our mind is preoccupied with something as we're doing something else. I know plenty of people who will be driving and their mind is thinking about something else going on within their mind, and it's as if their subconscious mind is driving for them. And they're just on autopilot essentially. And then when they come back to themselves, like, oh wow. It's like, I probably should have been paying more attention to the road, but it's the type of dissociation that happens. I'm sure it's happened to everyone. So that can happen in the present day throughout your life, and it can be chunks of time, hours at a time, and it can even be chunks of periods in the past as well. Maybe there's several years that you have no memory of within your past, things that have happened in the past that you have absolutely no memory of whatsoever. Maybe you don't remember people that know you even. It could be to the point where other people recognize you, know you. Maybe they even think, why are they going by a different name? Why are they acting different from how I remember them? Why are they dressing differently? And that's often because this is a different personality that is controlling the body at that point. And this person will not remember who this friend is of theirs. And that can become very complex when you deal with this as an adult and you have jobs, you have other people around you, family, friends even. It can be very difficult to function as a result. Maybe you don't remember buying things or going places. Maybe you wake up in some place that you have no idea where you are or how you got there because you dissociated along the way. Or maybe you look in your closet or you see notes or you see items that you don't know how they got there. You think that they're someone else's, but it was in fact you who purchased them, but it was a different personality who actually purchased them. So triggers. This is another major thing when it comes to people who have DID. This can be internal memories, be caused by triggers, such as thoughts, voices. So if you have some sort of memory within your mind going through your mind, and you have these voices going through your mind telling you these things, or certain random thoughts that appear, that can trigger different states within you. Triggers can also be external, whether that be going near or in a place that someone was abused. That can trigger certain memories to come forth, and then they could have a problem dealing with those situations because the memories will start to come back. Maybe even seeing people that abuse them, hearing words or phrases that have been implanted in them by the abuser. As we talked about earlier with the abuser's psychological tactics, what they will often do is they will implant certain keywords or phrases or something along those lines to make the other person comply. So whenever you hear that phrase or word as an adult, then that memory comes back and you are triggered into a different state. And the person is often unaware and they don't know the reason why they are upset or feeling depression or anxiety come up when they are around certain people or in certain places. So up next, we're going to be talking about the conventional way DID is handled.